welcome to the EM Code. I'm Dr. Vajiha, emergency physician by occupation. Join my quest in asking right questions from right people to get right answers. Our guest for today is Dr. Junjie Arapan. He's a second-year emergency medicine resident in the Philippines. We have somebody coming from the Philippines from the first time. Our schedules could not match, so he has sent a pre-recorded video. So I leave it on him to answer my questions.
Hi, let me introduce myself first. Good day, I am Dr. Junjie Arapan. I am a second-year emergency medicine resident here in the Philippines, and I also do YouTube videos trying to help other medical students and also prospective emergency medicine residents. Tell us about your first impression in ED. Did you have any thoughts about reconsidering your branch? For a little bit of a backstory, I started my residency in internal medicine. I was an internal medicine resident for 6 months, but then I felt like the life there did not fit my lifestyle. So I quit that residency and transferred to emergency medicine. When I went to emergency medicine, I felt that adrenaline rush, that everything needed to be fast and correct at the same time, and you have to be on your toes every day, every single minute. You don't know what's going to enter your ER. It's unscheduled. Everything is a surprise. Sometimes even the most textbook looking case will end up with a different diagnosis just before admission. You see a physical exam, something like this, and then the labs will return to you, and it's different from what you were considering earlier, and now you have to think very quick because you have to give medications to these patients. You have to deal with their pain, their symptoms, and you have to resolve those. And I think that was the thing that I was looking for. I needed action. I needed action in my life. I couldn't just sit in a clinic and wait for patients, talk to them, and then see them go to do rounds of all my patients every day in different hospitals. I thought that was quite boring for me. I didn't want that life. For some people, that's great. That's what they want. They want that stability. They want a schedule. They want to know what's coming into their doors. That's great, but a lot of different people have different characteristics, and I thought that wasn't for me. So for your second question, in India, people are coming with innovations to develop pre-hospital emergency medicine. What's up on your side of the city? Actually, here in the Philippines, emergency medicine is quite a young specialty. So we're just starting to put our foot on the ground and settling in, being known to be a specialty. Sometimes even some medical students don't know what emergency medicine is, or sometimes there's a lot of misconception about emergency medicine. Sometimes they think emergency medicine is internal medicine, but with a little bit of a twist, or it's internal medicine but you only stay at the ER or something like that, which is very wrong and very different from what we actually do in emergency medicine. So we're just trying to start up and build a larger group of emergency medicine physicians, and then once we establish ourselves, maybe that's when the innovations will come. Your journey into emergency medicine has not been a routine one, rather zigzag. Tell us more. I think I answered some of these questions in your first question. Yeah, it wasn't. I didn't go from med school to internship and then into emergency medicine straight to it. I went to internal medicine and then I quit that. I actually practiced to be a GP, a general practitioner, for 6 months, and then that's when I started emergency medicine. The good thing about that, I feel, is that I had a lot of experiences. Even in the emergency department, I was able to still use some of my learnings from internal medicine, especially when COVID hit, and then a lot of patients weren't able to be admitted quickly to their rooms, to the floors, so we had to manage patients in the ED for a longer period of time. That's when I was able to use my knowledge from internal medicine, and also from being in the general practice itself. I was able to interact with a lot of different doctors, a lot of different patients, and I have a grasp on how to talk to the lay people and explain to them how their diseases or their illnesses work, and how to counter it, how to better deal with it. So that's been my story. But I think I found my home here in emergency medicine. How do you manage academics, residency, and personal life? Here in our institution, our schedule is quite permitting to be able to have a personal life, the academics, and of course, the residency. Our schedule, we only go into 12-hour shifts. Either you're a morning shift, so that's 7 a.m. to 7 p.m. What we call a pre-duty shift, which is a 7 a.m. to 4 p.m. na shift, and a night shift, which is 7 p.m. to 7 a.m. So after that, you can do almost whatever you want. You can go out, you can hang out with some friends, you can do YouTube videos like I do, and just basically making a schedule for yourself. When do I see my friends, when do I see my parents, when do we go out, when do I make reports, when will I go on duty, or something like that. It's just about scheduling your life and putting a list of priorities, which one should go first, which is more important, and then just plotting it out on a calendar so you know when you're free and what you can do during those times. What is the level of awareness of emergency medicine in the Philippines? Well, people here in the Philippines aren't really familiar with emergency medicine. Sometimes I disclose to them that I am an emergency medicine physician, and they're clueless of what we do. So most of the time, they're familiar with internal medicine specialties, cardio, pulmo, neuro. Sometimes they're more familiar with the surgeons and people like that, but they're not really familiar with emergency medicine. So sometimes I even have med students who have no idea what emergency medicine is. That's why we're trying to put a emergency medicine rotation in our medical school, so that they would know the difference of emergency medicine from internal medicine and from surgery and from other specialties like family medicine. So again, we're just trying to set our foot on the ground and build a bigger base, putting out awareness of our specialty here, so that people will be more aware that when they go to the emergency room, most of the time they'll see an emergency medicine doctor. Has any doctor or patient misbehaved with you? Yes or no? How did you handle it? They have. Well, I think us in the emergency department, we're very prone to this kind of events, because we see patients and their relatives most of the time at the worst part of their lives, at a very bad moment in their lives, and sometimes they go into the ER screaming, shouting, telling you what to do, and then you being the doctor, sometimes it induces panic in you when people are shouting. But as an emergency medicine doctor, I have to be able to handle these situations. So I calmly tell them to calm down. If they won't, then I'd have security do fix that situation for me, take that relative out of the ER so that I can treat the patients, and also for the well-being of my other patients. Of course, if my other patients would hear shouting in the ER, they'd be more stressed, and that would be bad for them. So luckily, our nurses, our orderlies, our security guards are very aware of those kinds of situations. So when I tell them to take this relative out of here, so they are able to do that rather quickly and very effectively, but of course without physical harm to the relative. When dealing with misbehaving patients, I tend to try to explain to them their diseases kasi because most of the time they're misbehaving because they don't understand and they feel like they do not have control of what's happening with their body and with the situation. So I try to guide them na this is our plan, this is what's happening to you, and this is how we will go through this. So once you explain to them, most of the time they calm down, but sometimes they're still if they're still misbehaving, I talk to their relatives because here in the Philippines we have a very tight family unit. So explaining to the relatives that how we would go with the treatment of the patient, and let the relatives talk to their patient so that they would calm down a little bit more. Did you face any gender discrimination? Did you face any gender discrimination? Well, no. Being male, I didn't feel any discrimination. I think our society here in the Philippines is starting to open up a little bit more with the genders. If you're an LGBTQ plus or a man, a woman, our society is opening up more to that and we're more receptive to that. And also, being a doctor means understanding other people and respecting other people. No, I did not feel any discrimination around me. What was your most challenging case? Like where you feel that without your intervention as an emergency physician, patient's condition would have turned havoc? There's a lot of very challenging cases in the ER. Sometimes you see one every duty. But I think the most challenging cases for me were the COVID confirmed cases because recently we had a huge surge here in the Philippines, and there was a time where we couldn't receive any more patients because we were full. It's either I'm gonna put the patient on the floor and treat him or her on the floor, or try to send them to another hospital and find another hospital for them. It was very challenging because not challenging to the point where you don't know what the disease of this patient is, but it's challenging because you have to choose which patient will receive certain things because you have no more supplies. That was very challenging for me emotionally because it's very difficult to judge because I know to myself that if I don't give this patient this ventilator, he or she will die, but this one needs it more. And also knowing that there's no cure or no medicine for COVID, and meaning even if I give this patient a ventilator, their chances of surviving is still a little bit questionable. So that was very difficult. But sometimes seeing patients come into your ER with difficulty of breathing, then you give them oxygen, you intubate them, and then you sedate them so that they'll calm down, and then they get better. Just anyone getting better there at the ER, having a complaint coming in and then going up into their room with significantly decreased complaints, I think that's a win for me. You're a YouTube star. Actually, not so much of a star, but I'll take the compliment. You're a YouTube star. Tell us about your channel. Well, my channel is it started to be a channel for med students and pre-med students trying to go into medicine, and also trying to advertise emergency medicine to doctors who want to try residency. So that was where my channel started, but I kind of did a pivot for my channel. I started doing videos about illnesses, diseases, explaining trying to explain the vaccines, because here in the Philippines there's a lot of misinformation and fake news about the vaccines. So I did that so that I could reach more people, because I know that there's very little information out there on the mainstream media, and sometimes even the mainstream media have misinformation. And I used to be a med student residency channel, but then I pivoted into explaining diseases as simple as possible. But now I actually created a different channel, and I'm transferring those videos, those med school videos, to that channel, so that my subscribers won't be confused of what channel they're really watching, and so that the YouTube algorithm, as we all know, it won't be confused with my channel. How do you handle Google doctors walking with Google information as interpretation of their symptoms? Well, I try to answer their question, because most of the time they come in, you do your tests on them, and then you tell them this is your problem, and then they go back to you and Google said this, Google said that, and then I try to shoot down one of those diagnoses. Sometimes it becomes a differential diagnosis battle. That is possible. Like, here I go and say that disease is possible, but this is more likely for your age group, or this disease is possible, but you have this, so this would exclude that. So it's like I'm explaining to an instructor or an older doctor, but they're using Google. So it's a little bit quite offensive, to be honest, but I'm all for having them being educated, because at least they're putting time and effort on their health. So I appreciate that. So, but then you have to explain your side on why you think this is the problem of the patient. Because if you don't explain, if you just tell them that this is your disease and then this is what you will take, and then you send them home, there's very little chance that they'll believe you. You have to explain yourself, and that's one thing I think doctors should learn in this new era, in this new time, this era of the internet, is you have to be able to explain yourself in a way that people will understand. You can be at the top of your class, but the patients you treat won't understand what you're saying. And if they don't understand what you're saying, there's a very little chance that they'll do what you're trying to say, because there's a lot of other information out there that is very easy for them to understand. And if they understand something, even if it's wrong, even if it's misguided, they'll follow that because they understand it, and they don't understand you. And if they don't understand you, they'd rather go a different direction. How has residency changed your personality? Good way and bad way. Residency here in emergency medicine made me a calmer person during arguments, because there's a lot of arguing in the ER, arguing with relatives, arguing with patients, sometimes arguing with a different department just to go down to the ER and see a consult. Sometimes there's a lot of arguing, and being able to articulate yourself without shouting, without talking bad to other people. I learned that rather quickly, because it's a skill that you definitely need as an emergency medicine doctor. I think communication is the best tool that any emergency medicine physician should have, and not just communicating with patients, also communicating with other departments, because sometimes we have to play referee when ortho and surgery are fighting over a diagnosis or who goes to OR first, and sometimes you have to play referee in the there at the ER. So you have to, okay, what's the problem? So you have to deal with that sometimes, because you're the captain of the ship at the emergency room. So that's what changed. I learned to be calm and to handle conflict better. Your experience in pandemic the best and the worst experience, what were your concerns? I think I've answered this on an earlier question. Again, just having very little supply and not being able to treat patients because you don't have this, you only have one of these, so you have to choose which patient will receive it, or you don't have room for the patient anymore, so you have to send them away even if you want to treat the patient. So that was our pandemic here. Actually, it's still ongoing. It's still ongoing. We have around 5,000 to 7,000 cases a day, and we have around 90 to 100 people dying of COVID every day here in the Philippines. So that's why I'm a huge advocate of the vaccines, get people vaccinated. I think that's very important to stop the spread of the disease. So that's why I pivoted the channel also. What are the difficulties emergency physician in your country face? How do you make up for it? Well, sometimes we're discriminated here in the Philippines as emergency medicine physicians because there's a lot of people out there, especially some of the older doctors, that you need to have a specialty so that you will have respect, and you need to specialize on something, and you can't be a general physician. Like, you need to go into pediatrics, or you have to go internal medicine or cardiology or surgery so that you'll earn respect. You can't be a general physician. And basically, emergency medicine, you are a general physician just in the way that you need to know how to handle everybody. You need to know how to handle a pregnant patient, a child. You have to be able to handle someone who came in for suicide. You have to be able to handle cardio cases, neuro cases. So basically, you have general knowledge over everything. But here in the Philippines, there are some physicians, not all, some physicians who think you need just one specialty so that you'll gain respect. And if you're a generalist, you're just a basic doctor. So that's one thing that's very difficult here. But I hope things will change, and that's why we go into these into social media, trying to promote emergency medicine, trying to bust some of the myth around emergency medicine, and telling students that about what emergency medicine really is, and not what their seniors or what their mentors were telling them. So that's why we try to have interns and fourth-year medical students rotate into emergency medicine so that they themselves would be able to differentiate emergency medicine from internal medicine and where the line is between the two. What's the coolest app that you use that helps you in the ED? I think I have two. I have this Quick EM, which is it has adult complaints here, pediatric complaints, calculators. So when you tap on the adult complaints, you see the chief complaints of the patient, and then you tap on one, headache, head injury, syncope. So when you tap on one, you see differential diagnosis, possible differential diagnosis of headache, history, what you need to ask, physical exam, what you need to look for, tests, what you need to test for, management, possible medications that you can give. So it's quick. Sometimes there's just that time when you have a mental block at the ED, so you can look at it real quick. Also, another app that I always use here is the MedCalc. MedCalc, it has a lot of calculators. You need equations for EGFR. You need calculations how to correct hyponatremia real quick. And in the ED, sometimes you don't have time to do the manual calculation. So it has a lot of calculators here, and you can even put a star on your favorite equation so that it's right there on the home screen. So you just tap it and then you're able to calculate. And then last one that I always use is Medicode. Medicode, it's a quick guide on how to do BLS, ACLS, PALS. So it shows you an algorithm on what you need to do so that you're guided every time. Especially early in my residency, I always look at it. So sometimes, okay, it's a systole, so continue CPR. Or sometimes, is this a shockable rhythm? Yes, administer shock. So CPR again for 2 minutes. So sometimes early on in my residency, I always use this. I always whip out my phone, and so just I'm guided. So as to where I am in the process of the code. And right now I've been doing this for almost 2 years now. So I'm now quite familiar and I use it less. But early on, it was really a big help getting me through codes. You have been switching between specialties. What have been your challenges? When is the perfect time to move on? Well, the challenges of switching specialties is that you start again from zero, and that's a very very difficult thing to think about, and that's very difficult to accept because you've already put time and effort into this specialty. Like when I was in internal medicine, I always hear people saying, "You're already 6 months into this. Just go, just try to finish it." But to me, that was very hard to let go. That 6 months, it was only a few more months till I go into second year, and I already got the flow of how to become an internal medicine resident. So that was a challenge. And also another challenge is that your batchmates will leave you behind because you'll be starting again. You're starting back from zero, and then they're moving on. So my batchmates back then are already graduating internal medicine residents this year, and I'm still on second year, and emergency medicine here in the Philippines is 4 years. So that's quite a big setback, especially I want to graduate real quick and to help my parents with our finances. So that's a big step back that you should be able to accept if you switch specialties. Now, when is the best time to move on? When is the perfect time to move on? When I think the perfect time to move on is when you don't see yourself doing that specialty anymore. So you have to look long term, like within yourself. Do I see myself doing this, not the residency work, but the consultant work, the attending physician work? Because residency, it will pass. It's only 3 years, 4 years, sometimes 5 years for the cutting specialties. 5 years will go by. But then once you're a consultant, you'll do that for the rest of your life. So you have to ask yourself, do I see myself doing what my consultants, what my attendings do for the rest of my life? Because once you're in residency, you're gonna have a bit of an idea of what they do, what their schedules are. Do they have to wake up at 2 in the morning to go into the hospital and perform a surgery? Do you want that? Do you want to be able to do that for the rest of your life? Are you okay with that? Because if you're not, then you might want to reconsider your choice. Are you okay with dealing with kids or with children who are terminally ill? Is that okay with you? Or did you go into pediatrics because you want cute kids? Because part of being in pediatrics, you are gonna handle kids who are not gonna make it. So Are you okay with that? Are you do you accept that for the rest of your life? So I think that's one thing that you have to determine. And once you think that, no, I'm not willing to do what they do for the rest of my life, then I think that's the perfect time to move on. Tell us about your awareness program with respect to COVID. There's a lot of misinformation here in the Philippines. There's a lot of people just going into Facebook, into YouTube, just spewing what they think is correct about COVID, what they, without any background on the subject, without any research. And then people who are listening to these guys, and they start believing, because most of the time their explanation is easy to understand. Again, if they don't understand you, they will try to look for something that they understand. So when when they watch these fake news videos or misinformation videos, and they understand where these guys are coming from, and they feel the same way, and then now they start believing, and they now have misinformation on their brains about how COVID is, how it spread, how the vaccines work. So that's what I'm trying to counter in my channel, trying to explain COVID and the vaccines as easy as possible, as easy for the layman to accept, to grasp, so that they will understand more. And as a doctor, I feel like I have an advantage over these guys, because I'm a doctor, and these guys sometimes they're just people trying to explain what they feel. And people, sometimes other people are drawn to their emotions on their videos. So I try to become as rational as possible, as calm as possible, in trying to explain or sometimes debunk other videos. So that's my channel, and that's what I pivoted my channel into. So thank you for this opportunity again. Thank you, and I hope you have a good day. You stay safe always. Thank you. Bye.
Thank you so much, Doctor, for your time and effort. It was a pleasure having you. Thank you for making my work easier. I'll drop down the link of your YouTube channel down there. People who would want to see the videos he creates for awareness can go have a look. And I'd also like to compliment the amazing editing skills. Thank you so much for joining the EM Code.